everyone. Thanks so much for joining us. I'm Stephanie Baker with Team Celeste, and we are doing a virtual town hall tonight with a very special guest. We are joined tonight with Celeste Williams, who is running for Congress here in Arkansas's 3rd District. And our guest tonight is Magaly. Magaly is originally from Leon, Guanajuato, Mexico, and she's lived here in Arkansas since 2004. She had an interest in the labor movement, and it's led her to become involved with poultry processing workers here in Northwest Arkansas. She's participated as a steering council member of HEAL Food Alliance and co-chair at the National Steering Council of Interfaith Worker Justice. Her vision is to ensure fundamental human rights of poultry workers, and that led her to collaborate with the Coalition of Immokalee Workers to expand worker-driven social responsibility to the poultry industry. So in 2009, Magaly was a co-founder of Veneremos, who has been doing great work here in Northwest Arkansas. If you haven't liked their Facebook page yet, please find them and do so. Thank you for joining us, Magaly.
Thank you for inviting me.
So let's jump right in. Magaly, would you tell our viewers a little bit about your organization, Veneremos, and why you founded it and what the purpose is?
Yeah, so Veneremos is a new organization that we founded in October 1st, 2009. And the mission is to ensure the human rights of poultry workers. But as you mentioned before, the long-term goal of Veneremos is to create a program that I hear so many noises, and I'm not sure if people. I'm sorry. I'm trying to be.
I'm hearing a lot of feedback as well. I'm not sure where it's coming from. I'm going to just mute the other microphone and see if maybe that helps.
Yeah.
Okay. I think it was coming from Celeste. I think there's some feedback or something coming from your end. I'm not sure what it is, but when I mute you, we don't hear it. So I'm going to just mute you for a second while Magaly's talking. Sorry. Go ahead, Magaly.
So Veneremos, the mission is to ensure the human rights of poultry workers. But as you mentioned, the long-term goal is to adopt the model that was created in Immokalee, Florida, the worker-driven social responsibility model. So we are going to be creating a program that is based in the code of conduct of the demands and needs of poultry workers, and we are going to be targeting the supply chain of poultry plants so that we create these legal binding agreements between Veneremos and the supply chain, and therefore there is market consequences if they don't follow through this code of conduct. So this is why, and the need is because really I founded Veneremos with a group of Latina poultry workers who've been fighting for years for improving the working conditions in these plants. And so we believe that this program will change systemically the issues that they've been facing for so many years.
Thank you. What do you see, or what have you heard, is the #1 issue facing workers here in District 3 right now today? What would workers want our viewers to know about their current working conditions?
Yeah, well, really, it's been like almost 3 months fighting, and workers have been organizing and trying to bring the awareness to the public about the situation during COVID-19. Poultry workers, even before COVID-19, they face horrible working conditions. And right now, during this pandemic, those issues had come like stronger. Right now the workers were not protected, and so we saw that the companies were acted too late in protecting these workers. And so right now what we are seeing really is the consequences of these companies of not protecting their workers with PPE, with social distancing, and with benefits such as basic leave that workers who have never had. And so workers are punished for missing work if they are sick. And so right now The huge concern is, of course, getting sick of COVID-19 and bringing that to their families, that we are seeing right now. The workers don't have full protections, and also that the companies are not really preventing on containing the virus inside the plants. And that's what we are seeing, increased numbers of COVID-19 cases, that right now it's a public health concern too.
Yes. I'm going to unmute Celeste because the next question is for you, and I hope that doesn't mess up the audio. I'm seeing comments saying that it's better, so we'll hopefully it'll sound okay. But Celeste, this next question is for you. From what you're hearing Magaly say that the workers need, if you were in office, from a federal perspective, what can Congress do to make this situation better, to alleviate it right now?
So one of the things that she touched upon was paid sick leave, and I think that is certainly very important, as well as family medical leave as well, if you have a loved one that you need to help in their to help care for them while they're ill, as well as, like, you know, who's going to take care of your children, because there's a lot of problems with daycare and schools being, you know, of course it's summer anyway, but I do think from a federal perspective, we do need to have just a very robust public health infrastructure in place so that we can address these types of problems, because certainly this will not be the last pandemic that we face. And we need to have a strong federal plan so that we can use the power of the federal government to help create safer workplaces, as well as to have a plan that protects communities and the individuals who live within them. And right now, there really isn't any leadership coming from Washington. And so what is being done is at the state and local level. And you know, we have situations where the governor of various states, including our own, do not always want to empower local leadership to make decisions to try to help keep their communities safe, such as requiring mask wearing, because that is something that will help reduce the spread of COVID-19. And we need to make sure that at the local level, leaders are empowered to do all that they can to reduce the spread. And certainly, just as an aside, I would always encourage everyone to do their part. Wash your hands, stay home if you're sick, and wear a mask when you're out in public, especially if you are in a public building. You know, there's not a need to wear a mask if you're out on a trail in the middle of nowhere and there's no one around you. But otherwise, there needs to be some standards that are driven by data and science to keep people safe.
Yeah. I want to take a moment to remind our viewers that if you do have questions, you're welcome to put them in the comments. And towards the end of this broadcast, we'll get to as many questions as we can. So just put them there in the comments and we will try to address them as we have time. So Celeste, you mentioned, you know, that this won't be the last pandemic, and we don't know how long this is going to last. We're still working on vaccine research, and we just don't know what we're facing. It's an unprecedented situation. So Magaly, I know that these issues are not new. There have been working conditions that are unbearable for a very long time. But with this COVID-19 pandemic, those issues have been exacerbated. Can you expand a little bit upon that and tell us how this is affecting the communities that you're seeing?
So yeah, I think that I want to really touch base on, like, the importance of us working together to overcome this crisis and this pandemic. And I want to emphasize this because what we are seeing is that the current government is backing up the corporations, and they are sacrificing human lives for the sake of profits. And I think this is very important to really bring awareness of the people, because ultimately what happens to these workers, as we are seeing right now, is going to affect the communities. And so whenever we began seeing the hotspot of COVID-19 across the country in the meat packings, we saw this like a red flag, right? Because Arkansas is packed with processing plants. And we saw that And then we saw that the government or the corporations began lobbying with the government to protect the corporations and to order this executive order by Trump administration that states that the plants should remain open in order to, despite of the outbreaks. And really, this had caused so many damage, so many people dying, so many people getting sick, and this is not sustainable. Not even for the companies themselves, is not sustainable. It's not sustainable to continue sacrificing workers, because if all of them are sick, if most of them die, who is going to process the food that we consume every day? So we really need to acknowledge the importance, like these workers are essential workers. And by essential, it means that without them, our food supply will be in a great danger. And this is not about like picking and choosing to work, because I hear a lot of people saying, well, why do they can quit their jobs and find other jobs. We're in a very crucial situation economically. Millions of people are unemployed. It's not easy to find other jobs, and we will always use, or we will always need people who will be process our food. And that is just, if these people leave or not, someone will have to do this job. And so we need to secure their safety and health in order to overcome this crisis together. Because if we don't take care of this right now, as we are seeing in the government, like in Arkansas governor, he is refusing to acknowledge that by shutting down the facilities with outbreaks will give tremendous impact in containing the virus. But if he just sees and he keeps backing up the corporations for the sake of profits, really, they made us believe that there was a shortage of meat, and that therefore the processing plants should remain open because we will have a crisis and food crisis and so on. What we learned right now is that 130,000 pounds of meat were sent to China in the month of April. So this was not just to save the economy or the food supply in our country. These workers have been sacrificed for the sake of profits. And so in order for us as a country, as a community, to succeed and to overcome this crisis, we really need to act together humanely, because COVID-19 has shown us how vulnerable we are. We are biological human beings, and they keep insisting and seeing this issue as a racial issue, because they know that the majority of these workers are Black and brown people. But eventually, we are all sinking, right? Probably we are gonna be the first to go, but really, we are all sinking in this issue, in this crisis. So the problems that workers have been facing even before the pandemic, it's about this mass production. The line speed issue, it's been one of the huge concerns for workers. During the Trump administration, the risk of increasing the line speed from 145 chickens per minute, they wanted to increase it to 172 birds per minute. And during this pandemic, we saw that the government waived some of those petitions. And right now, some of these plants run, the line speed, it runs up to 190 birds per minute. This is inhumane. This is unsustainable. And this cannot continue, because we are going to be facing a health crisis, a food crisis, an economic crisis on top of this pandemic. And this needs to stop. And we really need to work together to pass on these problems that we are seeing right now in this community.
Thank you, Magaly. There's a whole bunch in there that you said that I want us to expand on, but I would like to remind our viewers that Celeste Williams, who's running for Congress, is also a family nurse practitioner. So Celeste, I'm going to ask you to put on your nurse hat now and just tell us, from a healthcare provider's perspective, what should we be doing in these communities? What would help right now to keep these communities healthy and safe?
So right now, I think the number one recommendation that I would make is making sure that everyone has protection, that they have, like that they can wear a mask, and that needs to be in all areas of the facility, whether it's break rooms, bathrooms, etc. And then we really need to make sure that we are doing good contact tracing, that we have a large number of people being tested so that those who are positive and either asymptomatic or pre-symptomatic, that those people can isolate and quarantine so that they do not pass on the virus as well. And I do think that, you cannot have people who are sick at work and expect other people to remain healthy. And I think that this virus has certainly highlighted the weaknesses that we have in our society that have been there all along. And, Magaly was right in that, the only way we get through this is together. And so, I think the most vulnerable people in our society, we have to really make sure that we are protecting them. And oftentimes the most vulnerable are those who are living in poverty. And, that requires a living wage. We sometimes in healthcare, we talk about social determinants of health. The really wealthy live on average about 15 years longer than someone who's living in poverty. And that is immoral to me. That is because we're not investing in these poor communities and communities that are distressed. And so, those social determinants of health are things like access to high quality and healthcare. And if you do not have a job that provides benefits, maybe you're working part-time, or it is too expensive for you to afford the healthcare, then you're not getting good care. You're not getting good preventative care. And it's much cheaper to prevent a disease than to pay to treat the disease later. Aside from that, it's, health starts in our homes, our communities, and our schools. And it's making sure that children have what places to play, that in the community there's sidewalks so that you can go for a walk and have access to healthy activities. Making sure that there are economic and educational opportunities, because those are the things that help to lift people out of poverty. So making sure that we have policies in place that are really supporting our families, things like pre-K, making sure that there's good job training for trades type employment, as well as affordable college education. And those are really provide a ladder for someone to have a better life. And we need to make sure that everyone in our community has the same opportunities.
That actually touches on the next thing I wanted to talk about, Celeste, which is income inequality, because that is at the root of many of these issues. And there was a study by the Economic Policy Institute recently where they looked at 916 different metropolitan areas nationally, and Northwest Arkansas ranked 15th in inequality out of that 916 group. And it showed that the top 1% of income earners here are making 37.5 times the income of the bottom 99%. And we know that children of color are twice as likely to live in poverty as their white peers. What can Congress do to take direct action to close that income gap and allow all of our working families to not just survive, but actually thrive?
Yeah. So I think that policy, we have to have people in Washington who will propose policy and legislation that really strengthens our communities and creates opportunities for a just and equitable society. And so when we think about that, we really do have to sort of wage a war on poverty. And that is making sure that we're investing in distressed communities, not just investing in places like downtown Bentonville, which is thriving, but let's make sure that all communities also get that investment as well. And if we ignore, rural communities as well, that we do not, there's not a lot of investment that happens in rural communities. And it's finding ways to partner with public and private cooperations that we can really make sure that we are lifting all communities up. fair wages, affordable health care, really thinking about too, like criminal justice reform. Are we criminalizing mental health problems and substance abuse? Or wouldn't it be better if we actually invested in making sure that we had access to mental health care, where we can really reduce a lot of those problems? And, if you have, I think of, being a former foster parent, many of the foster children that I've met over the years were in a home where their parent had either a mental health or a substance abuse problem, on top of living in poverty. And that really destroyed their family, where I think if you really make sure that everybody has access to good mental health care and just physical health care, which mental health should just be part of healthcare, then that really creates better opportunities and really makes it to where we all have opportunity, not just someone who looks like me.
Thank you, Celeste. I'm going to address a couple of viewer questions now. We have quite a few that have come in through the comments. Magaly, this one is for you from Laura. She's asking about the timeline that you anticipate for Veneremos to develop the worker-driven social responsibility model for Arkansas, and how do we work towards implementing that?
Yeah, well, really, we need to secure more funding in order to launch a bigger campaign and bring more staff. Right now, it's important to people that knows that I've been organizing workers since 2014, and this is a new organization that is built with poultry workers, led by poultry workers, but we are all volunteers. Well, I'm really a full-time volunteer in this work, and so we are building our budget to bring more staff, to bring more people, and we want workers to be part of our work directly, because we believe that the people directly affected are the ones that knows the solution and that can be part of the decision making of our work. So we center workers' voice a lot. So we need really more funding donations so we can start. And right now we are doing a lot of work on researching the supply chain and what it makes sense strategically. But we need more funding in order to launch that campaign that will bring systemically changes to this industry, and that will make a huge impact in the poverty that Celeste was talking about.
We had another question, Magaly. Somebody was wondering, how has Tyson reacted to your demonstrations? Have you been able to get in touch with their HR for a meeting? Have they listened to you?
Well, Tyson, it's very difficult for them to come and look for you whenever it just takes time. I've been approaching and working a lot with investors, so Tyson investors and shareholders who are very supportive of workers' rights, and through them we've been also really trying to bring them to talk and to find solutions together, but they have refused to do so, and they really have refused to listen to their own workers, because back in April, workers gave and tried to give a petition, and they in that petition they clearly stated what the demands were, and so Tyson refused to listen to that. However, we were able to send it to the CEO with help with shareholders, investors, and so it's been like Tyson has been changing some of that because of the public pressure and because of everybody has been participating in our calls to action and calling them, sending them emails, letters. So they've been reacting to that, but this is not nearly to what we want them to do in this moment. They could do way more than what they're doing right now.
Celeste, there was also a question here that's somewhat unrelated to the Tyson and poultry industry, but recently Trump discussed that he would like to slow down testing and then announced that he would indeed end federal funding for testing sites. A viewer is asking how you think that might impact Arkansas, if it will. Oh, sorry, hold on one second. I forgot I had muted you. Go again, sorry.
I think that's a terrible idea, and I hope that they change. And if the Trump administration does decide to stop funding, then I think Congress, which is supposed to be a co-equal branch of government, must hold the administration accountable and mandate that they not do that. And it is Congress who appropriates funds. Congress holds the purse. And so they need to make sure that money that has been appropriated to certain funds is used in that way. That would be a terrible idea. Disease does not go away just because you don't test to know that it's there. It's still there. We just don't know about it. And so then it spreads even more through the community. And it will not disappear. We will just have more people who die and more people who show up in the hospital without a diagnosis.
Thank you for that. Another question that I'm seeing come through is about surprise medical billing and how to end that. Is that something that, as a Congresswoman, you will want to address?
I think we need to have transparency in billing and some accountability to make sure that people are not, in surprise billing. I think about someone whose insurance tells them we're going to pay for this surgery in this facility, and they go and they have their surgery done, and then they get a surprise bill that it wasn't covered because the anesthesiologist perhaps was not in network. Well, people don't think to ask all of those things before going for a surgery. And so I am certainly think that is a real problem and it needs to be addressed.
I agree. I think it shouldn't be that hard to interpret your bills.
No, it should not. And certainly healthcare in this country costs entirely too much. And, if we were getting the absolute best healthcare in the entire world, then one could maybe justify the amount of money that we spend. But when we're spending almost 3 times as much money per individual as other countries, and we actually have a declining life expectancy and worse healthcare outcomes, then that is problematic and we're not getting our money's worth. And the reality is most of the healthcare dollars that are spent in this country are taxpayer dollars in the form of Medicare and Medicaid. And we absolutely have to make sure that taxpayers are getting their money's worth in their investment.
We are coming close to the end of our time. I don't want to take too much of Magaly's time. We're so grateful for you joining us tonight. Magaly, before we go, what is it that you want people to know? People who are watching now and they're outraged by this, that they're learning, what actions can they take to improve working conditions, to support working families here in Northwest Arkansas? What would you ask them to do right now?
Well, right now, our communities are really suffering. There is a lot of suffer, pain. They've been through a lot of how do you say, since March, they've been going and feeling like they are gonna sick and they don't know if they're gonna survive. Many of the workers who had been sick and didn't even have symptoms, they're all survivors of everything that these companies have made them go through. Our communities are in pain, and that we all need to stand up and support organizations like Veneremos, because we are a worker-led organization built by workers, and to support the efforts of calling to actions and be engaging in our work constantly, to see, right now there is a lot of needs, like food, billing, housing, paid wages, all of that it's happening here in this pandemic. And so I want people to be more engaged into our work and support our work. because we give voice to workers. And workers are part of all the work that I do. Obviously, I am the spokesperson because for many of them, coming to cameras and speak up will mean that probably they will lose their jobs. Workers are often terrified to speak up because of the retaliation that goes in, and the intimidation and harassing really that these companies do to these workers. So right now, it's very important to continue putting pressure to the governor so he can order the shutdown of the facilities with outbreaks. That's what really the workers want, and that they deserve that they deserve to be paid and quarantined, and workers who have been sick, that they should be saved, and the workers who are currently sick, they should recover fully, because it's not fair that the company is letting them or telling them that they need to come back to work after 10 days of testing positive, and knowing that they might infect other workers. And this is just inhumane, and that people need to know that these workers need all your support.
Thank you, Magaly. Celeste, would you like to close us out, say anything else to our viewers?
I want to just thank everyone who is watching right now, and I hope that we will all go out and try to amplify the voices of people who are doing the work. So Magaly, thank you so much for all the work that you have been doing, and I completely agree with you. Workers' rights are human rights, and this is a moral issue. I truly believe that I and probably a lot of other people were called to love our neighbors. And, you know, there's no exception to who that neighbor is. And I think that our society is only as strong as those who are the least among us. And it is very important to make sure that we bring everyone up and give everyone opportunity. And so I certainly appreciate the conversation this evening. And I hope that, I just thought of one other thing. There is a free testing for COVID, and that'll be at NWAC from 4 to 8 on Friday. And if you have been around anyone who has tested positive, or if you have symptoms, and you don't have to have symptoms to go get tested, then I would encourage you to go get a test.
Thank you. For our viewers, I was going to link to Veneremos' Facebook page in the comments, but it looks like Sarah already beat me to it. So you have your link there. You guys can go visit the Facebook page and show your support for working families here in Arkansas. Thank you both. Thanks to all of our viewers, and good night to everyone.
Thank you. Thank you for the invitation. Bye-bye.
Thank you.